Good afternoon, everyone. Thank you for being here. I think as we all have come to realize, COVID-19 has changed our world, and not just in Arizona. A writer who I'm a fan of, he's an AEI scholar, Nicholas Eberstadt, and Dan Blumenthal, I thought, put this best in a recent piece. The COVID-19 pandemic is the single greatest global peacetime catastrophe that humanity has suffered since the end of the Second World War. Barely months into what promises to be a multi-year disaster, the pandemic has already cost America alone over 100,000 lives, tens of millions of jobs, and trillions of dollars in lost output, income, and wealth. The ultimate toll for the world as a whole from this pandemic, both the direct and indirect consequences, may still lie beyond imagining. And COVID-19 is widespread in Arizona. It's in all 15 of our counties. It's growing, and it's growing fast across all age groups and demographics. Anyone can get this virus, and anyone can spread this virus. These numbers speak for themselves. 63,030 total COVID-19 cases in Arizona. We are averaging 2,750 cases per day. And we have lost 1,490 Arizonans. Now, at the last press conference, I said that our numbers were going in the wrong direction, and they continue to go in the wrong direction. The rate of the spread of this virus is unacceptable, and it's time for us to step up our actions and our personal responsibilities regarding this virus. Arizona is not alone. This is happening across the country and around the world. Some states were hit in March, April, and May. Our time of getting hit is right now, June, July, and August. I don't necessarily like to put these terms on what's happening here, but these are common terms that are being used around the country. This is Arizona's first wave, and this will not be our last wave. We are one of several states that is having a record in terms of daily cases, including California, Florida, Mississippi, Nevada, Texas, and South Carolina. Arizona is one of 7 states that is hitting a daily record of hospitalizations, including Arkansas, California, Florida, North Carolina, South Carolina, Tennessee, and Texas. Where we are right now and what we expect is manageable, but we do need to change direction on these numbers. We've learned from states that were hit before us and hit harder than we've been hit, but we are getting hit hard right now. We've learned from both their successes and things that they may have wanted to do differently. We are going to apply all of that knowledge. And like I said last week, we're going to remain vigilant, flexible, and humble as this virus presents new challenges at every turn. Now, this is Arizona's time of challenge. I don't want there to be any illusion or sugar-coated expectations. We expect that our numbers will be worse next week and the week following in terms of cases and hospitalizations. Whenever we make some changes, it takes several weeks for those changes to catch up in the numbers affecting real people. So there's more work to do. We can't let up. If anything, we need to redouble our efforts. The objective here is that we want to save lives and protect livelihoods. This is not an either or choosing one or the other. This is and both. We will err on the side of caution, and we will err on the side of saving lives. But the objective is to save lives and protect livelihoods. And how will we measure our progress? By slowing the virus and by protecting the most vulnerable among us. Now, the best way that you can help do this, and I want to enlist every Arizonan in this battle, because you personally can make a difference for our state and our nation, and most importantly, for your neighbor, for your family, for your parents and grandparents. If you will wear a mask, that will make a real difference in slowing the spread of this virus. 75% of our state today has guidance in place. And I want to thank our mayors and our county supervisors, our local leaders, and our citizens for their compliance with this. And I want to enlist everyone else to be part of it. There's no bigger thing you can do in addition to wearing a mask than these 3 steps. Every Arizonan can do their part of returning smarter and stopping the widespread virus in our state is a physical distancing. I'm physically distanced from Dr. Christ and General McGuire, so I don't have a mask on. When I came in, I did. Wearing a mask, being physically distant, that social distance, physical distancing is the same thing. And then, of course, washing your hands and staying home when sick. I know many young people out there feel invincible. And statistically, on some of these worst-case scenarios, maybe you have reason to feel that way. But your parents and grandparents are not invincible. And you can make a real difference in slowing the spread of this and reducing the risk. Now, Arizonans had 45 days of a stay-at-home order. Stay home, stay healthy, and stay connected. I want to say again, thank you for the cooperation and partnership. You did much to slow this spread, to allow us to prepare in every way for what would be our time of maximum illness and hospitalization. When we reopened the economy, I said that this is a green light to proceed, not a green light to speed. And most Arizonans have been proceeding, but we have had some speeding. And we've had some speeding in the business community, and we need to slow down. So the graphic I'd like to leave you with today is a yellow light to yield, to proceed with caution, to go slower, to look both ways. This virus is everywhere. It's likely in this room right now, and the actions that you take as a citizen will make a difference in how we care for our most vulnerable and how we handle remaining hospital capacity. So if there's one takeaway from today's press conference and the message that I want to share today, it's that you are safer at home. All Arizonans are safer at home, and you can stay healthy at home. Our cases are increasing, our hospitals are seeing additional stress, and they're likely to hit surge capacity very soon. Now, this is not another executive order to enforce, and it's not about closing businesses. This is about public education and personal responsibility. It's about asking every Arizonan to act responsibly, to do it for your family, for your friends, for your neighbors, for our frontline healthcare workers, for our parents and grandparents, and for our doctors and nurses and medical workers who are overworked right now. So remember, you're safer at home, you can stay healthy at home, and you can help reduce the risk for the most vulnerable in our society and ease this burden on our hospitals. The crowded social gatherings that we've seen must be minimized. We're not there yet as a state and around this virus. When we reopened the economy, I said, go out and get a haircut, get something to eat, and go home. I want to give that same message right now. If you don't need to go somewhere, if you don't need to go out, if you can work from home and stay home because you're safer at home.
As Governor Ducey said, you are safer at home with your household contacts. We like to call them your quarantine pod. But things that you should consider before going out: how many people will you interact with? So that is your highest risk, is going to be interacting with other people. And so you want to make sure that if you are in a group of people, you want to be wearing a cloth face covering. Not doing that and getting close to people is going to increase your risk. Engaging with new people that are outside of your normal cohort or your normal group of close contacts, for most people, that's if they do not live with you, that is going to raise your risk because they are going to have different exposures than you are. Some people have the virus and don't have any symptoms. They don't feel sick. They are out. And so they can still spread the virus. And so you need to make sure, just because somebody doesn't look sick doesn't mean they aren't carrying the virus. You're also going to want to consider, if you do need to go out, is it a place where you can remain 6 feet away from other people? Will you be outdoors or indoors? And so the closer you are to other people who may be infected, the greater your risk for coming down with COVID-19. If you can keep your distance, especially for those that are at higher risk of illness, such as older adults or those that have underlying medical condition, you definitely want to practice physical distancing. And indoor spaces are riskier than being outdoors. Outdoors, there's more room for you to be able to physically distance, and there's better ventilation. So you want to consider, is it an outdoor venue, is it an indoor venue, and how close will I have to be to other people? And then what is the length of time you will be interacting with people? And so that's another question you want to ask yourself. We consider in public health a close contact if you are within 6 feet of somebody for 10 or more minutes. The longer that you interact with somebody in a close space, the higher your risk for coming down with COVID-19. And spending more time with people increases their risk as well. And so you just want to make sure that you are, if you have to leave, that you are taking these